Welcome dear student. Today we start with the cardiac cycle. Objectives are introduction, phase of cardiac cycle, event during cardiac cycle, duration of each phase and applied physiology. In that introduction, the heart as a pump. The two separate pump in series, systole which is contraction and diastole which is a relaxation. The cardiac cycle is both the electrical and mechanical event from beginning of one heartbeat to beginning of the next. Duration of cardiac cycle. If normal heartbeat is 75 beats per minute, the duration of one beat is equal to the 60 divided by 75 is equal to the 0.8 second. Phases of cardiac cycle. Atrial phase or the atrial cycle which is 0.8, atrial systole 0.1 and atrial diastole which is 0.7, ventricular cycle which is a 0.8 second. In that ventricular systole is 0.3 second and ventricular diastole which is a 0.5 second. Atrial cycle. This atrial systole which is a 0.1 second coincide with last rapid filling phase of ventricles. Before these valves are open, ventricles relax with already 75% of blood contraction at only remaining 25% of the blood. Effects on the atrial systole. Intra-arterial pressure get increases right 4 to 6 mm Hg and left in the 7 to 8 mm of Hg. In intraventricular pressure increases, narrowing of the origin of great veins which decreasing the venous return. Atrial diastole which is 0.7 second coincide with ventricular systole and most of the ventricular diastole. Atria relax which is a gradual filling of atria and pressure slowly get increases. Ventricular cycle, in that the ventricular systole which is a 0.3 second phase, in that phase of isovolumic or the isometric contraction, phase of ventricular ejection which is a rapid phase and the slow phase. Phase of isovolumic or the isometric contraction which is a 0.05 second. When intraventricular pressure rises close to the AV walls, semiluminar walls not yet open, so contracts as closed chamber. No change in volume, so called as the isovolumic contraction. Sharp rise in intraventricular pressure. Phase of ventricular ejection which is 0.25 which begins with opening of semiluminar walls and rapid phase which is a 0.1 second, 2/3 of stroke volume ejected. This right ventricular velocity is less than left but duration is more. Slow phase, in that the 0.15 second, in that 1/3 of stroke volume get ejected. Ventricular cycle, in that the ventricular diastole which is a 0.5 second phase which is a prodiastole, isovolumic or the isometric relaxation phase, rapid passive filling phase, reduced filling and diastole, last rapid filling phase. Protodiastole which is a 0.04 second, in that ventricular systole ends and ventricles get relaxed. Intraventricular pressure falls, blood comes back from vessel to the ventricles, semiluminar walls close and second heart sound. They cause the dicrotic notch in the pulse. Isovolumic or the isometric lasts for 0.06 seconds, begins with closure of semiluminar walls, AV walls not yet opened, relax as closed chamber, as volume remains same, isovolumic relaxation and ends with opening of the AV walls. Rapid passive filling phase, in that the AV was open atria till now it diastole filled with the venous return with increased pressure caused the rapid passive filling of the ventricles, which is the third heart sound. As ventricular filling, continuous pressure differences reduces, so falling rate decreases, which is a diastasis. Total blood transfer with rapid and slow filling is 75% of the total arterial blood. Last rapid filling phase, in that, as said earlier, it coincides with atrial systole, add remaining 25% of the blood to ventricles. With this ventricular cycle completes. Events during the cardiac cycle, in that the pressure gets changes in ventricles, in atria, in aorta and the pulmonary artery. Next one is the volume get changed in the ventricle during the arterial systole, during ventricular systole. Pressure changes in the ventricles during the atrial systole, ventricular systole and the ventricular diastole. During atrial systole, which coincide with last rapid filling phase of the ventricles, pressure in ventricle is just above the zero. With contraction, pressure rises. In that, the right 6 to 7 mm of Hg and left 7 to 8 mm of Hg. During ventricular systole, isovolumic contraction, which is 80 mm of Hg, rapid ejection phase, 120 mm of Hg in left side and 80 mm of Hg in right side. Slow ejection phase, pressure start decline. Ventricular diastole, in that the protodiastole pressure drops rapidly up to 80 mm of Hg, and isovolumic or the isometric relaxation phase, in that 2 to 3 mm of Hg. Rapid passive filling phase further get falls and reduced filling and diastosis, pressure just above the zero. Last rapid filling phase. During the atrial systole, just before systole pressure is just above zero and slightly greater than ventricles. During systole, sharply increased left, which is 7 to 8 mm of Hg, and right 6 to 7 mm of Hg, which cause a wave in JVP. During ventricular systole, isometric contraction due to the sharp rise in pressure, AV walls bulges in atria in the C waves. Ejection phase, intra-atrial pressure drops sharply as the papillary muscles pull AV walls down, atrial volume rises and pressure gate decreases. Isovolumic relaxation phase, as AV walls remains closed due to venous filling from V wave in JVP. Rapid passive filling phase, as an AV walls open passive filling atria, pressure drops down just above the zero. Pressure in aorta is 80 mm of Hg. During ventricular systole, aortic pressure is less than intraventricular pressure, as systole continuous pressure reaches equal to the ventriculars, which is 120 mm of Hg. During protodiastole, the aortic pressure is higher than ventricles, backflow of blood, second HS and the dicrotic notch. Rest of diastole, aortic pressure declines slowly up to the 80 mm of Hg. Similar to the aorta, but pressure are low, systolic pressure goes up to the 15 to 18 mm of Hg and diastolic pressure up to the 8 to 10 mm of Hg. During atrial systole coincide with the last rapid filling phase. Out of total 130 ml in ventricles and 105 ml, 75% blood already reaches ventricle before the systole. 25 ml, it means that 25% transfer due to the atrial systole. During the ventricular systole, isovolume contraction get no changes, and ejection phase, which is 80 ml stroke volume. Ejection fraction, which is 80 divided by 130, is the 65%, and ESV is equal to the 50 ml. Now ventricular events, in that the first heart sound, second heart sound, third heart sound and the fourth heart sound. First heart sound cause the closure of AV valves and characteristic is the love. Duration is 0.15 second and frequency is 25 to 45 Hz. Site of osculation, which is a mitral and tricuspid area, correlation with ECG, coincide with the peak of the R wave. Second heart sound cause the closure of the semilunar wall. Characteristic is the dub. Duration is 0.12 second. Frequency is the 50 Hz. Side is aortic and the pulmonary area. Correlation with the ECG coincide with T wave. Third heart sound cause the inrush of the blood during rapid filling phase. Characteristic is duration of 0.1 second. Correlation with ECG appears between T and the P waves. In that the fourth heart sound, they cause due to the last rapid filling phase and duration is 0.03 second. Frequency is the 3 Hz. Correlation with ECG in that appears between the P wave 7 onset of the Q wave. Cardiac murmurs, abnormal heart sound during the cardiac cycle. Mechanism of production is produced due to the turbulent blood flow. They cause valvular stenosis, valvular insufficiency, valvular septal defect, and the corcotation of aorta. Types is systolic, diastolic, and the continuous. Duration of each phase. Effect of the heart is as the heart rate get increases, cardiac cycle duration get decreases. If heart rate is 200 cc is equal to the 60 divided by 200 0.3 second. Duration of each phase get decreases but diastole decreases as compared to the systole. That the applied physiology, coronary blood flow to the subendocardial areas occurs during the diastole. So diastole duration get decreases and the cardiac perfusion get decreases. Ventricular filling also occurs during the diastole in that the heart rate get increases and CO get decreases.